Hi, my name is Claudia Fotiu, and this is my CAP 2 submission for KIN 557. If you remember, this is Rio, our subject from last week. We're going to go ahead and obtain some biometrics from our subject, including their blood pressure, body composition, a waist to hip ratio. We'll go ahead and evaluate their sit and reach, as well as appreciate their range of motion for a shoulder, elbow, hip, and knee using goniometric measurements. Thanks so much. Ready to get started? Okay. Yep. You can stop as I fall over. All right. So the first metric we're going to go ahead and obtain is their blood pressure. So we'll have the subject seated, we'll have them palm facing up, back of the hand, dorsum of the hand rested on the thigh is perfectly fine. We're going to roll this up if you don't mind. Place the cuff securely over the upper arm. All right. If this flap is always covering, you can kind of pull back and adjust that as needed. Make sure the balloon is facing right here. You okay? Okay, and then you can go ahead and have them nice and relaxed. All right, we've got our ears in. First thing we'll do is we want to make sure this is fully to the right, nice and locked. We're going to palpate that artery. Once we have that artery, we're going to go ahead and replace our fingers with the bell of the diaphragm of the stethoscope. Place it nice and firmly. All right, get as much surface area as you can. For average height, average weight, we're probably going to pump to 180. If you have patients that are a little larger, you can go higher. To 180, we're going to hold that for a sec, really occlude that artery, and then we'll release slowly, probably at the rate of a second hand on a clock. Okay, so 110/60 is going to be our systolic and diastolic readings. Excuse my reach. There we go. So 110/60. So 110 will be systolic. That's the first beat we hear, the nice, loud, consistent. Give it a minute. Make sure you're hearing nice, loud, consistent beats. You don't want to be picking up artifact. And then the last one, that's going to be your diastolic. So 110/60 is going to be our blood pressure. Okay, the next metrics we're going to go ahead and get are going to be using the Jackson Pollock skin fold measurements. We're going to go ahead and obtain our skin fold measurements for female subjects located at the tricep, the thigh, and then also suprailiac. So the first thing we'll do is for the tricep. We'll go ahead and do your left one if you don't mind. I'm going to go ahead and lift the sleeve up. Okay, have you face to your side a little bit if you don't mind. That's perfect. And we're going to measure them in centimeters from the acromion process to the elbow. So what we can have you do, okay, we've got our centimeters here. I'll have you bend the elbow if you don't mind. That's perfect. We're going to go from that AC joint right up here. Okay, you can palpate that anatomical landmark right to the back there. Okay, so we've got about 38, 39. So let's see, that's going to put us at about 19, right smack in the middle. Go ahead and keep that flexed if you don't mind. That's perfect. So about 19, I'm going to place this down here. Okay, we'll take our grip. All right. And you can actually go ahead and relax your arm if you would. About a 3-inch grip. We're going to try to separate that tissue away from the bone. We'll place the calipers inferior to our grip, right at the base. Okay, get a nice good chunk there. Right. Hold for a second before we take our reading. Okay, we're going to write that down at 24 here. Okay, the next one we'll do is the thigh, so we'll have you face forward if you don't mind. And then we want to be conscientious of your comfort here, so what we'll go ahead and do is we'll do this. Typically you want to do this on exposed skin, but what we'll go ahead and do for you is we'll have you flex that knee just slightly. That's perfect. And from that inguinal kind of angle, that angle of the hip, if you don't mind me excusing my reach, I'm going to palpate right here. Okay, we'll come right about here from about that crease all the way to the knee. That's going to put us right about there. We're at 42, so we'll go to 21 at our halfway point. Right, we'll keep our finger here. We'll take our calipers once again. Same thing, 3-inch. Usually when you're on true skin, you can grab more skin. We're going to do our best here. Again, about 3 inches. Really getting in there. All right, inferior to our grip. We're going to push in a little bit to help hold that. Okay. And then we'll write that measurement down. We have 34. As mentioned, we want to go ahead and write these down so we're not remembering as we go. And then the last one we're going to do is just suprailiac, meaning above that iliac crest. So if you don't mind if I lift your shirt a little bit, okay? So I'm going to lift your shirt. We're going to palpate where that iliac crest is. We're going to come just a little bit above it, suprailiac, above the iliac crest. This is sort of a transverse approach. Again, I'm going to go up a little higher if you don't mind. I have about a 3-inch grip, separating that from the bony tissue. Same thing, inferior to my grip, holding for a second. Okay, there we go. We've got our number right there at about 9. Okay, so now we've gone ahead and we've obtained our measurements, and then we'll go ahead and we'll put them into the formula. Okay, so next thing we're going to go ahead and do a measure is the hip to waist ratio. We're going to go ahead and take this. I'm going to reach across if you don't mind. Excuse my reach. Perfect. Right at the innermost point of the waist there. Okay, as flush as we can. Ideally flush to the skin, but of course we want to be conscientious of our patient's comfort or our subject's comfort. So nice. Again, you don't want it super taut. Have a little bit of overlap to appreciate it. We're at 29.5 for the waist. Then we'll go ahead and we'll move inferiorly. If you don't mind, I'm going to go around your hips. Mm-hmm. Okay. Widest portion of the hips. Usually the greater trochanter is a nice place as an anatomical structure to start. I'm going to measure you on the side here. Okay. Making sure that this is all flat and flush. Okay. And same thing right here. We're at 39.5. So we have 29.5 and 39.5 respectively for the waist to hip ratio. So the next test we're going to go ahead and do is the sit and reach test. We'll have our patient or our subject square up against the wall, making sure that their back is in contact with the wall. We've got our measurement set up. We've got the heels at the 15 inch mark on our ruler. What we're going to have you go ahead and do is, again, hip width apart. We want the knees straight, fully extended. We don't want any flexion or creeping of flexion in the knees. You're going to bring both of your hands overlapping like this, right in front of yourself. Very good. And what you're going to do is you're going to slide across that. So what you want to do is you want to instruct the subject to take a nice deep breath in, an inhalation, and upon exhalation, you want them to reach out, making contact with the tape as they're going. And you want to go ahead and have them, once you are at your maximum, go ahead and hold that for 2 seconds so we know that we're getting a true reading as opposed to them stretching on strain. So we want to get true range of motion. Okay? Again, you want to keep the knees fully extended throughout the movement. Okay? So let's try that. If we can't, I'll go ahead and I'll take the camera here so we can get a better view. Okay? So we'll go ahead and we'll have you do that. You're going to be going with contact on the ground. All right? Whenever you're ready. All right. So that's going to put us at just shy of 13. Okay? Can you try it one more time? All right, what are we at there? All right, 14. Okay, there we go. So the first thing we're going to go ahead and do is we're going to look at hip range of motion. So we'll go ahead and we can do it a couple different ways. You can have them do it where they're bringing their knee to their chest, maximal hip flexion, or they can do straight leg. So what we'll have you do is we're going to have you go ahead and you're going to bring this knee to your chest as much as you can. Ready to hold there? There you go. Okay, so we'll line this up. You've got your immovable arm and your movable arm. Okay. So I'm going to come on out here, lateral to the pelvic, right about there. And actually we can follow the seam, although make sure that you're not following the seam directly. Okay, so bring this all the way. We're going to keep going with this. Okay. So that is pretty good. Okay, we're getting about 150 degrees of flexion in the hip, which is great. 150 degrees on the right. And then we can do another one actually where I'll take this leg if you don't mind. We're going to keep it straight leg. Right about there. Hold there if you can. Make sure that knee is nice and straight. Okay, and you'll notice it's going to indicate hamstring tightness. You're going to get a much less range of motion on that. Same thing right about here. And that's going to be almost exactly, maybe a little hair more than 90. Okay, so right about maybe 95. So you can tell these two tests, they're going to be able to help you observe different ranges of motion. This one checking for hamstring tightness. Do you mind if we have you swivel around so we can do the opposite leg? Okay, so thank you very much. That was going to be on your left leg. So we'll do the same thing too. If you don't mind, you're going to go ahead and flex that knee all the way to your chest and you can hold. You'll leave this leg nice and straight. I'll go ahead and scoot back if you need to. There you go. Okay, so same thing, side of that pelvic girdle, excuse my reach. Okay. Same thing right about here to the side. That's gonna be fixed. Okay. And same thing on this side. Okay, we're just getting one. Let's see, from there, we've got about 143 on that right side. And then we'll do the same thing. We're gonna have you go ahead and relax. Actually, we'll bring you back. Nice and relaxed here. Straight leg. Bring you back, fully extended. Keep nice and straight with that knee if you can. Let's go ahead and relax a little bit more. Right about there if you can hold. Okay, you can start to appreciate a little bit of flexion there in the knee. So same thing, you can tell there's huge differences between having them do flexion. You can see a little bit of a basic shape there. Okay, we'll have this immovable arm. Squeeze and reach. Okay. And again, that's going to be right at about 90. Again, we're looking at that femoral condyle as our landmark. Not so much here, but that femoral condyle. Okay, and so you're 90 on this side. So that's going to be hip. And for knee, actually we're in a perfect position. We can appreciate the right knee. Same thing, go ahead and flex as much as you can, Good, right there, nice and relaxed in the hip. Okay, right there, so that goes to that femoral condyle. Right, this is going to be your fixed portion right here. We're going to bring this down as much as we can. Okay. And again, here we're getting about, all right, about 143. All right, so this is the knee. So we have about 143. And then can you straighten this one as much as you can? Go ahead and interim back if you need to, so you've got a little more space. Okay, there we go.
And again, we're just trying to appreciate if they have any more extension, which it looks like we're going to be at 0 for this one. Okay, so for extension, we're at about 0. Okay, do you mind one last time? We'll have you flip around.
Thank you very much. Okay, and we'll do the same thing. There you go. So same thing, a movable portion. The stationary arm will be along the femur, and we'll have you go ahead and bend that left knee as much as you can. Bring that heel nice to your rear end. But you want to go ahead and do it on your own without using your hand. Yep. There you go. Make sure this is nice and flat. Very good. Make sure you relax that hip too. Again, right through that femoral condyle, so you can palpate that as well. Okay, stationary arm parallel to the femur. We're going to bring this one all the way down. Okay, trying to go right to that femur. And again here. Okay, we're right in the middle, about 145. Okay, so we'll have 145. And then for the knee, we're looking at the left one. And I'll have you go ahead and straighten that out all the way as much as you can. Really push down nice and flat. Again, against the femur, right through that transverse portion of the condyle. Okay, and that's 0 as well. Okay, there we go. So that's going to be hip and knee range of motion using the goniometer. Then we'll go into the shoulder and the elbow as well. You can self-report. So next we're going to go ahead and do shoulder and elbow goniometry. So first we'll check shoulder flexion, then we'll do extension, and then we'll do elbow flexion on the one side so you can see. So starting with our space here that we've got, we will have this. What we'll go ahead and do is we're going to have them flex that shoulder, just a little bit right about there. And where most of that motion is occurring, where you can appreciate most of that motion occurring, that's going to be where we're going to see our axis right here. This is movable. The stationary arm is going to be lined up with the midline of the thorax. Right? Okay. And we're going to have you go ahead and continue flexing as much as you can. So you're going to keep going all the way. Okay. So on that right side, we've got 170 degrees. Okay. And what we can have them do is actually, I'm going to have you go ahead and then we've got you on the right side. So right side will be 170. Let's have you flip onto your stomach if you don't mind real quick so we can show how we would do extension of the shoulder. Okay. So this is the opposite now. Okay. So what we'll have you do, I'm actually going to have you face your head to your right if you don't mind. That's perfect. Same thing.
Okay, we'll have the stationary arm right here. I'm gonna have you go ahead and elevate that shoulder as much as you can. That whole arm. Keep going right about there. Wow, okay. So let's keep your chest nice and firm with the ground. There we go. Okay. And that's just about, with that lateral epicondyle, about 40 degrees, you can see right there for shoulder extension. Of course, these are opposite sides, but I do want to be able to demonstrate the skill. And then last, we'll have you go ahead and flip on over one last time, so you'll be supine one more time, just so we can demonstrate these. Okay, again, for elbow flexion, you can have them nice and relaxed. Stationary arm will be in line with our humerus. Okay, just about this, right at that epicondyle. Okay, we'll have you at about like a neutral kind of sword. There we go. Okay. And we're going to go ahead and have you bend that elbow as much as you can. Keep going, keep going. Usually you're going to get soft tissue approximation. That's going to stop you before anything else. Okay. And again, right about there, you can kind of sort of see. I'm going to freeze this for you. We're right in the middle at about 145 degrees flexion. And again, that's usually because of soft tissue approximation that's going to stop us. So that's how we do shoulder flexion, extension, as well as elbow flexion on the goniometer. And if you can appreciate, you're not too lax actually. If you think right about here, we're going to flip that a little bit. Perfect. Okay, we've got you at about 0 there for extension as well. All right, so that's me shoulder flexion, extension, elbow flexion, extension with the goniometer. Thanks so much.